So it's now recording. Okay, so so let's talk. These were when I first had a meeting with David and Ann. These are the things they presented to me as what they were looking for in a PRM solution for Trinity. Number one, a tool that adapts to your needs and workflows. You know, there's a lot of companies that the product, they build it, and the expectation is you're going to adjust your stuff to the way their software works. And they were saying we want something that adjusts to us. Secondly, the ability to customize the information by market. In other words, if I'm in Tennessee, I don't want to see providers in California. I want to see the things that are relevant to my marketplace, things the practices and the contacts and the activities and so on. That it be scalable to hundreds of users. The ability to handle non-provider accounts. And I assume those are like your specialty, the departments that you're doing outreach for.
It's also things like EMS departments or dialysis clinics, things like that.
The ability to track your outreach activities, to associate outreach activities to initiatives, to capture, track, and report back on issues and opportunities that might be raised while you're in the field. The ability to automate notifications to responsible parties, the ability to integrate with your claims or referral data from SB2, integration with Outlook was brought up at our last call. So these were the things that they said, before you tell us anything, this is what's important to us. Anything that's not on that list that anybody that's new to the call would add that we should think about. That's it.
So Sarah just added ability to modify provider and organization accounts at the user level. So active data management.
Okay.
Thank you, Sarah.
And it's just a minor correction, but it should say SG2 instead of SB2.
Thank you.
Yep.
All right. And if you threw it in chat, there's too many screens on my desk. I can't follow it, but let's go with that. The good news is everything I'm about to show you handles all of these things just fine. So I think these will come out in the demo as we go, so I'm not going to go back through them. But I thank you for your feedback. So why did we build our solution on top of a Microsoft product, namely Microsoft Dynamics 365? So what is Dynamics 365? It is a Microsoft's solution in the CRM, or customer relationship management sector. This has been their platform for people who do outreach, no matter what their industry is, to assist them in their interaction with their accounts and their contacts. In the companies that look at software in our industry, organizations like Gartner and Forrester, for 20 years now, they've rated Microsoft as one of the top 2 CRM platforms worldwide. So it's Microsoft and it's Salesforce.com. And the two of them are the number 1 and 2 in this market space globally, and have been for years. Next year, Microsoft might be on top, the year after Salesforce, but this is truly a competition between, the Mercedes and the BMW. It's not a conversation among the Volkswagen and the Hyundai or something. Not that there's anything wrong with those cars. So let's get into a little bit about what makes this a good platform for Trinity. The first thing you have to understand about Microsoft Dynamics is it's not a standalone product as far as Microsoft is concerned. Microsoft's solution portfolio covers a whole bunch of products that all interrelate with each other. So those that are involved in IT might be aware of the phrase Power Apps or Power Platform. Power Platform is part of Dynamics. Power Apps, Power Automate, Power BI are all incorporated into the product. Every day you guys are using Microsoft 365. That's your desktop suite. Word, Excel, PowerPoint, SharePoint, Microsoft Teams, Microsoft Outlook. Those are all part of Microsoft 365, and every single one of those things are fully integrated with Dynamics. Copilot is what David and I have been talking about. That is Microsoft's substantial investment in artificial intelligence and bringing that technology or weaving that technology into the things we're talking about in terms of physician outreach and so on. And that is a product getting a high amount of investment and is evolving very quickly and will continue to evolve. If we as a vendor decided, let's build our own platform to do physician outreach, there's absolutely no way that we could stay on top of all of these things and deliver a viable outreach application. So by partnering with Microsoft, we get to ride their coattails. We get the benefit of all of this investment, and we get to focus just on making the solution we're going to be presenting to you as focused on your needs as possible. Now, when you hear CRM, most organizations think of three functions: sales, marketing, and customer service. So when you build a solution on top of Microsoft Dynamics, on top of Microsoft CRM, there's a whole bunch of data entities or functions that are already baked in the cake. They're already built in. We can use those functions as Microsoft gives them to us. We can extend or modify those functions to suit your needs, or we could ignore them altogether. In addition, we can add things that Microsoft never planned to put in the product. Things like initiatives, things like events, things like issues and opportunities. We can extend that database to accommodate all types of new information that you can capture and report on. So for instance, if I were a service line department, I would have an account for that service line. I would have one or more contacts that I interact with at that department. I might have outreach activities that I've had with that department. That department might be part of an initiative or an event that we're going to be promoting. That department may have provided us handout materials that we're going to be giving out when we do a visit on behalf of that department. But an account might also be in a referring practice. Now, it's still an account, but it's different. It's a practice that has providers and people involved in referrals. They might have issues that they raise and opportunities. You do outreach activities with them. There may be contracts or agreements or something that you have with them that you've attached to their record. Some of my clients also want to track vendors, third-party entities that are, caterers, restaurants, and so on, that they work with on a regular basis. One nice thing about Dynamics is if you say this is a service line department, then the form can present the information that's relevant to a service line. If you say this is a referring practice, that same form is going to look different because it's going to be asking and displaying information relative to that type of account. So the first huge nice thing about Dynamics is the tremendous flexibility it gives us to quickly create data elements, define them exactly the way you want them, set up relationships among them, and style them to be the easiest for you to work with. So that's the first part of Dynamics. The next part of it is Dynamics has its own security model where we could define security roles uh, uh, and define who has access to what they can see and not see, and we'll show an example of that in a minute. It provides full audit logging. So, gee, who changed that record about Dr. Polino? The audit log would tell you on February 8th, David went in and changed my category from A to B. Full logging. The ability to quickly create automations when I'm out on a visit and Dr. Lieberman has a complaint about something. I fill out the complaint form, but then I want the details of that complaint to be emailed to the responsible party for that department. And I want a follow-up reminder to be put on my calendar 3 days from now to follow up. Those would be examples of an automation. And Dynamics gives us the ability to create simple or very complex automations and do that quickly. As I mentioned, the integration with Microsoft, all the desktop stuff, as well as with Power Automate. That's a product that has over 1,000 pre-built connectors and the ability to create custom connectors. And that's the vehicle we can use to connect this CRM platform to other important systems in your organization, such as Epic or SG2. I'll get that right. You'll see in the demonstration, dashboards that will be your front end to the system to quickly tell you what's important for you today, what meetings do you have coming up, what issues have been outstanding, and so on. A very flexible reporting tools. All of this information that we collect lives in something called Dataverse, and Copilot, which is the artificial intelligence engine, monitors all of Dataverse, indexes it all so that it can provide functionality back to you. And then the last part about Dynamics is it works on any type of device. Footnote, a Windows computer, your Apple computer, perhaps at home, your tablet, Android or Apple, and your smartphone, Android or Apple. These are all have the ability to be accessed, and they're all included in the base system. Now, I had mentioned security, how that works in Dynamics. Now, some organizations have very flat security. Everybody sees everything. But the comment I had gotten in my initial meetings with Ann and David was, well, we'd like to be able to filter it down. If I'm in California, I only want to see the ones that pertain to my region. I took this off your website. Looked to me like there might be a West region, a Midwest, a Northeast, and a Southeast. So I made up my own regions for you. So in Dynamics, you can set up the system business units to say, we have a corporate level is the business unit, and then we have 4 regions, business units, West, Midwest, Northeast, Southeast. And then we have security roles. So anybody at the corporate level, let's say, is a group leader, meaning they have access to everything anywhere in the system. When they pull up a dashboard and want to look at visits, they see each region, and then they could drill down to that region and see each rep or each territory. In the West region, we might have concept of a team leader and members of the team. And some of my clients might say, well, if it's a team member, the member should only see the appointments, the issues that they've created. The team leader for that team should be able to see the appointments, issues, and so on of all the members of the team, but not the other teams, and so on within each team. But at the corporate level, they see everything. And so my point is that when you get to a large organization, sometimes this information needs to be compartmentalized, and Dynamics does that out of the box. It's just there's no programming. It's just done as part of the implementation to configure it. And I just gave one example here. The key thing in everything you're going to see from this point forward is I'm going to show you something that's an example. But if you come back to me and say, well, I don't want it that way, can it do it this way? Usually the answer is yes. In other words, you're going to see one way of doing it, but no 2 of our clients do it the same way. And the system is very receptive to being adapted differently within each client. Any questions from an introductory standpoint? That's what I'm going to do.
I think no questions yet. We're just excited about the demo.
All right, here we go. All right. So I'm going to start the demo where I start my day in Microsoft Outlook. And here you can see I'm in my Outlook inbox. I have a couple of emails. When I go to read that email, you can see a preview of it here. This one is from Ann. When you have our system implemented, your Outlook and our PRM system are interconnected. And what that one of the ways that comes into play. So let's suppose I received this email from Ann, and it's an important communication, and I want to make that part of the history of the interaction between me and Ann. When you have our system, this Dynamics 365 button will automatically appear in your Outlook. When I press that button, what it's going to do is query my database and see if Ann is already a contact in the database. And you could see it came back and said, yes, she is. Here's her title, her phone number. She's with Trinity Health, and be nice to her. You're working on a 50 user opportunity with her. Now, if I wanted this email to be stored as part of my activity history with Ann, all that I need to do is hit that blue button. It's going to copy that email, any attachments, and store it under her contact history so that anyone who has access to Ann's contact record would now see and have access to this email. So as quickly as that, it updates the CRM for me. Now, another email I got was from David. And same thing, when I hit that Dynamics button, it's going to go out, query the database, and it's going to come back and tell me David's not there. Unknown recipient. But in this you might get, especially when you're starting up, you don't have all your contacts in the database yet, and you need to build it. Now, if these things weren't integrated, what I would have to do is leave Outlook, go into the PRM, go to the contacts area, add David as a contact, and then come back to Outlook and work with him. But because they're integrated right from here, I can say add him as a contact. Now, what the Dynamics 365 app does is it does what it can. It gets his first name, it gets his last name. I could take the one out of there. It gets his email address. And if I wanted to, I could copy and paste his phone number, his job title into the record, and then tell it to save, and it would create a contact record. So that's what the free app for Outlook does. But to show you one of the differences, anytime you see the word Copilot with something Microsoft, that means artificial intelligence. So you'll see I also have Copilot for Sales in my Outlook. And it's going to do the same thing. When I press it, it's going to go look for Dave in the database, say he's not there. I can say add him as a contact. But now you'll see it parses his email and the email signature. So it's going to, I don't know why it didn't. There, it pulled in his job title. It pulled in his phone number. Further down the page, it would populate his address. So just by artificial intelligence, it's saving me that extra copying and pasting, building a more complete contact record. When I hit save, now he's added to the database. So just to show you a couple of the integrations between my inbox and the PRM. That same integration works with my calendar. Now, I could initiate an appointment as I did today. I can create it in Outlook, and that same Dynamics 365 button appears. So I can create the activity in Outlook, and with a single button, add that activity as an activity with all the related parties back in the CRM just by a button push. It also works in reverse. I can create appointments inside Dynamics. Dynamics will push that appointment out to my Outlook calendar. And it behaves just like an Outlook appointment. It would have, if it's a Teams meeting, it would have the Teams invite in it and so on. The third integration between Outlook and Dynamics happens with tasks, follow-up reminders. So here you can see I have a task to follow up with Dr. Lieberman regarding access to the provider portal. Now, that task was actually created in the PRM from a quality improvement, from an issue. It was a task, a follow-up task that I would see on my dashboard in the PRM, but the PRM is outputting that task to my Outlook calendar. So I don't have to go to two places to see everything. I can see everything in either of those two locations, Outlook or the PRM system. And if I were to mark this task as completed, add a note, mark it completed in Outlook, Outlook is going to turn around and update that task within the PRM for me, update the note, and then mark it as completed. So that's some of the integration between Microsoft Outlook. Any thoughts, comments? Can we check that off? That
there have been lots of heart emojis and clapping hands flying in the world of a physician relations person. To me, this is game changing. I can't tell you how giddy this makes me just because we manage so much work in our Outlook all the time or in our email. So having that integration to me is a game changer.
Wonderful.
Anyone have any
Yeah.
other thoughts they'd like to share? Totally agree, Sarah says. Okay, awesome.
Wonderful. Okay. So now I'm in the system. So I have a Windows computer. I'm using Google Chrome. You can use Microsoft Edge, Firefox, Apple Safari, any of the major browsers, and log into the system. As a user, the first thing I see is my dashboard. And I know it's mine because it says my PRM. Now, different users can have different dashboards depending on the role that they play in the organization. So the My PRM dashboard is geared toward the outreach, the liaison rep, and it's meant to show you your world. So this is showing me what QIs, what issues do I still have open that I'm waiting to resolve or hear back from the responsible person for. We'll talk about QIs in a minute. Who are my active targets, the contacts that I'm targeting for outreach? What are my upcoming appointments? We can provide charts. So a lot of our clients, the liaisons, have certain goals. You need to make so many visits per month. They might be so many by different categories. So during the month, we could provide you a dashboard that says, here's how many you've logged in each category, and have a second bar next to it that says, here's what your goal is. So day by day, you get a visual reminder of where you are relative to your visit goals for that month or quarter or whatever it might be. Here it's a chart showing number of visits by each member of our team. Some people like to show that just so you know where you are relative to your peers. And I can see what tasks or follow-up reminders do I have. So this is just an example of what a typical liaison dashboard could look like. And it's meant to act just like the dashboard on your car. You turn the key. Do I have enough gas to where I'm going? Is there anything that needs my immediate attention? If not, I'm putting it in gear and I'm going. That's the whole idea here.
Hey Rocco, with
Yep.
with that share function, do you see that being used as members sharing them with their covering managers as to, hey, this is what I'm doing for the day, or these are my tasks for the week?
It could be the manager will have a different dashboard,
Okay.
and that dashboard will have a wider scope. So I think that we can take that into account and not make it something you need to think of to do. We could just build it into the dashboard. So this is typical of a manager's dashboard. They're not looking at one liaison, they're looking all of the members of their team. And so here's how many visits did you have broken out by who did you meet with? Leadership to MD, MD to MD. Was it a provider interaction, an office staff? And each color represents a different liaison. Obviously, Rocco's the hardest working member of the team. Appointments by interaction type. How many of these were in-office visits, virtual meeting, team meeting, phone call? So it's breaking it out by rep, by type. Here it's showing me a stack by rep, by territory. Here it's breaking it out by specialty. How many did each rep have within a given specialty? So these are just meant to be examples of what's possible. It could have been a grid showing all of this week's appointments by rep or something like that. So, yep. And the whole idea of everything we show is purely to stimulate questions, and then We gather what would be useful to you, and then we incorporate those as changes into the system. Again, just to make it as smooth functioning as possible. Any questions about dashboards? Or the whole idea of dashboards is to take data, turn it into a visual, so you can look at it and consume it quickly and take action. There's even my favorite is these weather maps. So if I want to see how well am I covering my territory, just like in the weather, I can get heat maps that change color based on obviously I'm making a lot of calls in Western New York, some in Central, a couple in Albany, but the Central New York area needs some additional work. You can draw that inference just based on that visual. Okay. So let's look at some of the building blocks of the system, what gets built when we set it up, and then we'll go through the key things of logging a visit, logging an issue or complaint, and then reporting and so on. Okay, so in Dynamics, a account would be a practice, a service line, a clinic, an EMS, whatever it might be. Each one of them would have an account. So I use Bay Creek Internal Medicine. So that account has an office manager, their phone line, back line. We can classify them. Is it a growth retention type scenario? What's our relationship with this account? What type of account is it? Is it a non-provider or referring practice? And we can set it up so that if you choose non-provider, then things that only relate to providers would disappear from the screen, just so it doesn't clutter it. You see things that are relevant to what you expect to see for that type of account. Are they on CareLink? Some of our clients categorize their accounts ABCD, which determines how frequently we do outreach to them. What's their address, office hours, what EMS do they use, what practice management, what market are they in, when's their fiscal year end, stuff like that. Over here, I see a grid of all of the contacts that we interact with at that account. And in the center, I see it's called the timeline. The timeline would be emails, appointments, phone calls, tasks that I or any other CRM user have entered that relate to any of these contacts at this account. So this is all interactions everyone has had, most recent on top. So if your manager wants to know what's going on with Bay Creek, they don't have to wait to reach out to you. They can quickly see what correspondence, the most recent visits. In my demo, did we ever talk to them about pediatric cardiology? Well, I could go to this bucket of all of the interactions with this practice. Like pediatric cardiology, and it'll say, yes, back on 2/3, pediatric cardiology was one of the meeting topics that Rocco had with them. And if I want to read the meeting notes, I can see that. So it takes all of this pile of information, makes it very easy to navigate around and gain insight from. So that's the account record. The contact, yep.
I was just going to say for the group, just to highlight, I think this is really key just because in those areas where we see cross coverage or folks that are out on PTO or have different job descriptions and titles and may assist every once in a while, knowing that they can go to this as a quick pulse check to figure out the activity prior to walking in the door is a great insight before engaging with the providers and the practices. And not only that, but it also outlines the recent opportunities, which is also key too. So you kind of know what you're getting yourself into before you even walk in. through the door. So I just wanted to, reverbalize that for the group.
Thanks, Dave. You'll see there's a tab here, contacts by radius. We built this when we started working with hospitals that had reps with rural territories. I'm going to Bay Creek. I've had people tell me it's a 2.5 hour drive just to get there. So while I'm out there and I'm planning for that trip, I might want the system to tell me, who do I have out there within a 50-mile radius, let's say. And here we're taking advantage of the Microsoft Bing Map function. It's querying the database, showing me all of the contacts, and then it'll throw them on a map for me within a 50-mile radius of Bay Creek. And then I could make a decision. So you can tell I'm in central New York. So here are the contacts. Here's a listing of them and their address by name, and I could see who's where, make a decision of who I want to call on after I visit Bay Creek because they happen to be nearby. I can print this out and take it with me and so on. Just wanted to point that out. So we covered the account. Contact would be the people within the practice that I want to track within the system. And that's, so you might track Dr. Lieberman and his scheduling nurse, you may not, or an office worker, you might not. But within the contact record, in this case, Dr. Lieberman, I have his job title, the office address, the last date we visited with him, his specialty, office hours, his rating, what territory he's in. One thing we added, I was talking to the rep handling another account that we've just implemented a couple months ago. And she said that, well, when we put their system in, IT gave us all kinds of data about providers, but that data doesn't tell them who the liaison is that covers them. And not every provider in the database is what they call active target for outreach. So what we did was add a field that the rep could easily go to say, if Dr. Lieberman is an active target for Ashley, here's the reps in the territory. I can select Ashley. I can even have multiple reps covering that same doc if that exists because of whatever reason. But now that this is what would tell if Ashley were to go and say, and I'll show you in a second, show me all my docs. Instead of seeing every doc in the system, she would see the ones that that is a doc that she is targeting. Now, when I look in the timeline with Dr. Lieberman, I see all of the activities that I or any other user have had with Dr. Lieberman. At the account, I saw all accounts. I can see any issues or QIs, we call them, they're complaints usually, that Dr. Lieberman has filed, and any events that Dr. Lieberman participated in. Place for personal notes. And we haven't worked yet with SG2, but once we do, we might be able to not only see outreach activities, but peek into the referral data as well. I think that's the ultimate goal, is tie those two worlds together. So I could see what Dr. Lieberman's payer mix is, Aetna, Blue Cross, Independent Health. I could see referrals by month. I could see year to date by payer, referrals. So things like that, to be able to visualize that data as I go. So this is information about the contact that lives in the system. We would set up initiatives. So here's an initiative for that pediatric cardiac surgery. Any user or department can set up, or team can set up an initiative, give it a title, what cities it applies to. This would be a great thing to say if it's a regional initiative, that only that region can post activities to it. If it's a national initiative, then all users would see it. What the purpose of the initiative is. So I create the initiative and then I start logging visits, and those visits reference one or more initiative. When I go back to this initiative, I can see all of the visits that I or any other rep have had that logged a visit to that initiative. So sometimes initiatives have events that we sponsor to also promote awareness and activity. So I can say, as part of that initiative, we're going to do a meeting of clinical partners on 3/17 at the Hotel Henry. And I use Dr. Lieberman a lot. He is an internal attendee, meaning someone from the service line, a specialist who's going to speak at our event on that day. And then who the attendees were, who showed up at the event, refers who showed up at the event. And this not only lets me say, we as liaisons attracted these people to this event, but it also lets you report out on which docs are helping you by engaging and participating either in ride-alongs or events uh, uh, to help promote their practice or service line. So now we have accounts that we've loaded, contacts that we've updated, and initiatives. The rep is ready to go out on rounds. So the system can help targeting. So for instance, in my world, we have A, B, and C contacts. So I'm going to ask the system to give me any of my A's and B's. A's and B's are supposed to be seen every other week or something like that. And I especially want to see anybody who's an A and B, but who have not been seen, that their last visit date was on or before February 17th. And here's a list of all of the docs that meet that criteria. I go out on rounds. I make a visit on Dr. Lieberman. And this can be done any number of ways. But I can go to his contact record, log an appointment. Now, appointments, visits can be after the fact. In other words, I went on rounds and I just spoke with them today. Or they could be appointments that you pre-set up. You go to the appointment and then you come back and update it. Our clients are kind of 50-50. But here's the information, some of the information we can capture about a visit. So it was with Dr. Lieberman. What type of visit was it? And our clients tailor these. It was a MD to MD visit. What was the type of interaction? We were in office. Was this visit part of an initiative? Yes, I only have one available. It was that one. Did you leave any sales literature behind? Yes, the pediatric cardiac surgery has a brochure. This was a late February 25 visit. It's on the 27th at 3 p.m. What additional details? Some of our clients, what I found out is they have talking points, things that we frequently bring up. So if I talk to them about access, alignment, the Department of Medicine, I can just check those off of the drop-down list. It fills them in up here. In the old days, we used to list the talking points and you would go in and change the no to a yes and it would list it. I think I like this approach better.
And one thing I'll point out to everyone, the fields that Rocco is demonstrating now are all customizable. So should we go in this direction, we'll be able to work together as a group to tailor the workflow and the drop downs and all of the relevant information to our specific needs.
You could type in a description of what took place. Some of our clients want the liaisons to just enter numbers. How many providers were in the meeting? You don't have to list them by name, just tell us how many. Is there any follow-up action as a result of this meeting? Yes, I need to send Dr. I can type in what the follow-up action is. Do I want the system to create a follow-up task that would appear on my dashboard? Who owns that task? I do. And when will that task be due by? Well, I have an office day tomorrow, so I'll put in to have it done tomorrow. If we had any expenses that we track, I can put in the expense type and amount. If we already said this was part of that initiative. So when I'm done, the system is going to save this visit, and then an automation is going to kick off and create a task, assign it to Rocco. It's going to have this in the description, and it's going to have this follow-up date assigned to it. Now, this entry of the visit can be done here on my PC. It could be done on my iPad. It could be done in the field, at home. Doesn't really matter. Now, let's suppose also while I was out on this visit, Dr. Lieberman had a complaint that he brought up during the meeting. I did notice with this other client, and you asked this question in the meeting, can the issue log and the visit be combined on the same form? And that's what they did. It's just another task, so you do it all at one time. I'm showing it as something. So we call these quality improvements, and I'm not very creative. So let's say it was an issue with a sleep referral that came from Dr. Lieberman. Now on the form, it wants his job title, phone number, and email, but I'm not going to enter those things because I linked this to his contact record. It's going to pull all this information from his contact record for me. What type of issue is it? Is it a complaint, a compliment, a concern, an improvement, an issue, a suggestion? What's the category? It's a scheduling. Where did this take place? We have several locations. It was at Grove Hospital, and it was regarding our sleep center. Do we need to get back to him? Yes. I received it today. He had this issue yesterday. The current status of this complaint is we've received it. Who is the responsible party or parties, meaning who at the sleep center at Grove Hospital is responsible for scheduling complaints that I want to communicate with? And in that world, it's Amy Coddington. And if I wanted to, I can add her supervisor, Becky Trevino, if I wanted both of them to be notified of the issue. What's the issue? Well, Dr. Lieberman was given a referral appointment So I put in what the issue is, and then I'm going to check here to, yes, I want an email to be sent. So I filled in a bunch of information. When I hit save, you'll see this other information gets filled in for me. Now, normally when I log a complaint, I would log it, then I would go to Outlook and type an email to Amy Coddington to explain to her all of the details. I would send that email, and then I would go to my Outlook calendar for a few days from now and put in a reminder to follow up with Amy just so I don't forget. So this is an example of a workflow, of a process. And it's just my example. Yours might be different. If I look in the activities related to this issue, you'll see that two things have been created as a byproduct of me entering this QI. First, the email was sent, and the email is very personalized, very detailed. It tells Amy a scheduling plaint has been received from, and it inserted the doc's name. And then the details in the body of the email. Here's his contact, his phone number, his email, the date of the incident. Here's what the problem was. We need verbal feedback. Please contact Jeff. Here's his phone number within 48 hours. So that email went out to Amy. And on my dashboard and on my Outlook calendar will be a task, a follow-up task with a due date of March 2nd, 3 days from now. And if that happens to land on a weekend, that's okay. It'll just roll over to the next day with a reminder to me to follow up with Amy regarding Dr. Lieberman's complaint. And again, these behaviors will work no matter what device you're working from. Usually the last thing that I show in a demo is reporting. So throughout the month, you're entering visits, you're entering issues, opportunities, and so on. Along the way, there needs to be metrics and reports. You have your dashboards, but usually there's more to it than that. So in Dynamics, there's all types of reporting tools. But the one our customers love the most is what we call Excel templates. Now, many people are familiar with using software that exports data to Microsoft Excel. But when you do that, typically what you end up with is what's going to show up here. Bunch of rows and columns of data and so on. And from here, you need to make something out of it. Well, what we do with Excel templates is we take that data and format it for you automatically. So if you look at the bottom, you'll see different tabs on this spreadsheet. So if I want to see liaison visits by category, I could see each liaison it has an appointment listed. I could see the months of the year, how many visits they've logged, breaking it out by interaction category. And if I want to fine tune it, I can say, well, just show me certain types of visits, or just show me certain liaison. If I only want to see in-person visits, I could filter it. It will adjust from there. Likewise, if I go to visit type, same thing. I'm seeing how many visits we had by visit type and a graphic that shows that. So Excel templates take the latest data based on the most recent input and formats it so that when you pull up that template, you not only get the data, but you get it organized in a way that's helpful and useful to you, whether it's appointments or our QIs Same thing. The raw data comes here, but if I want to see complaints by category, here's how many we've had. If I want to see it by category, by department that it was about, if I just want to see who were our scheduling complaints with or our IT issues, it was that one. Or if I want to see scheduling, this is just a breakout of scheduling. And we had complaints from our cardiac center, rehab, sleep center about scheduling. So lots of different reporting methods. We saw the dashboards in the beginning. Excel is just another way of doing reporting. The great thing about it is everybody knows Excel. And with a little bit more training, we can show you how to build your own reports if you wanted to be able to do that. That is the scope of what I planned on showing today.
This is great, Rocco. Thank you so much. I'm getting people chatting me with different feedback, but I do want to open the forum to the group. Any questions that you all have regarding functionality or any of what Rocco showed today that you'd like to explore more in depth? Or any general comments from the group? Hey, Melinda. Yep.
Yeah, I have a question about implementation. Having still have the scars from several Salesforce implementations, does your company also assist us with implementation, Rocco, or is that separate?
Yeah, great question. Thanks, Melinda. We own the implementation.
Okay.
To my clients, they talk to us more than they talk to their IT. Because we would have lived with you for 3 or 4 months. We know why you're asking the question, not only because you asked it, but because 20 other clients that are doing the same thing you're doing. So I think we're a great partner to work with. I mean, think of how many times you've explained something to somebody and they go, well, why do you do that? They just they don't understand what you do. And we work, I think the two hardest groups I've ever worked with in my career, in or out of healthcare, were liaisons and physician recruiters. And we've spent the last 10, 15 years of our lives only working with those two groups. So we have a dedicated process that we just follow. We go through a design phase. I mentioned it to Ann, I'll say it to the group. First thing we do after we receive a contract is we have a kickoff meeting. Ann will form a team of people who are going to work as part of the project team. And we're going to send you something called a planning guide. The planning guide is going to provide screenshots of every form in the system, every dashboard, every field. And we're going to encourage you to go through that planning guide, cross off anything you don't want. We're going to show you what the values are in every drop-down list so you could take the ones off that you don't like and add the ones you do. If there's fields you want to see on any form that you don't see on our planning guide, you just write them in. Tell us, I want to enter text here. I need to enter a number here called this. And there is no limit to the number of adds, removes, or changes that you could make to the system, either during implementation. So we're going to go through a period of design, and here's our standard system. Tell us what would make it more relevant to you. And then we're going to give that guide back to you with your changes in it. You're going to sign off on it. Then we go through a build phase where we're going to build what you asked in a live system. We're going to show it to you. and you're going to get a chance to see it and go, now that I see that, can it do this? Or what about this? In other words, what we found is sometimes it takes 2 or 3 exposures to get the really good ideas out of people, because people tell me I don't know what to ask for because I don't know what's possible. Well, by 2 or 3 of these meetings, you get a good feeling for it. So we do our first build review, get your feedback, incorporate those changes, do a second build review, get your feedback again. And these are about 1 to 2 weeks apart, depending on people's schedules. Then we do a third build review. If everything's okay, we do your final data load, and then we're ready for, IT calls it first meaningful use. We do end user training, provide you a training guide that not only helps you in your training, but as time goes by, people leave, new people come. So you can use that guide to quickly onboard new people into the system. We have clients that call, a couple times a year, they hire somebody new. Hey, can you take Mary through the training you took us through a year ago? Absolutely. So we deploy it. We focus on user adoption. We actually give managers dashboards that show them who's entering stuff and who isn't. The ones that aren't, the ones that are, we don't worry about because they're doing it right. The ones that aren't, maybe not everybody learns at the same speed. And so maybe we'll do a follow-up workshop to cover QIs or something if there's a group that we find just haven't gotten it yet. We totally get that. We totally understand it. And we provide advanced training for those who want it. David expressed an interest in artificial intelligence. Someone else on the team might want to know how to create their own ad hoc reports or whatever it might be. You might come up with new ideas of what you want on your dashboard. Well, now we're 30 days past go live here. This relationship that I described continues for as long as you're a client. So 6 months down the road, 9 months down the road, you get a new idea. Now, with such a large group, there might be a process by which changes get made. We don't want to take something out and find out another group is you. I mean, we'll need to have a structure for that. But the key is we are tethered together for as long as the contract is active, and any new changes, enhancements, improvements, new workflows, new reports or dashboards, they're all included in the subscription price. So there's never any new charges or costs unless you add users to the system.
So Rocco, we've had a few questions about data. So how do we get the system set up? And the way I've been answering in the chat, but I want you to chime in on what's possible, maybe that I didn't think about. We can provide you with lists to get started. So we can give an account list, a provider list, locations, whatever, however we need to do that, we can provide that. But in the future, we could also do an integration with whatever our provider data management solution is. Today, we're using Simpler, or our medical staff. Like we can do various integrations. So I know that's feasible. We've talked about that. And then can you also talk a little bit about the identification of new providers and what's possible there? What have you seen work with other clients?
Sure. So a key thing is that when you add a provider, that there be a unique ID for the provider that other data sources recognize. So in our world, that's either a physician NPI, or a lot of hospitals, most of them are using Epic, the provider's Epic ID. As long as that, I would recommend that we only load data where at least one of those 2 fields are present. What other clients have us do, so let's say we go live June 1st. That's aggressive. It usually takes contracting longer than that. But let's just say June 1st. I didn't say 2025. The By August 1st, September 1st, new docs have been credentialed at the hospital that you don't know about yet. Now, liaisons tell me they find out about the new doc that a practice just hired before the hospital knows. That's fine. You can, somebody asked, I forgot to show it. Anybody can go in and make edits to the records at any time. So whoever brought up the question about can we make changes locally? The answer is yes, you can. Now, so if the data that came from the hospital system was wrong, you can change it in CRM in my system, but my system isn't going to go and change it back in the hospital system. But what our systems frequently do, our clients frequently do, is they get a feed once a month, let's say, of newly credentialed docs from some source that IT provides, might be credentialing. We feed them into the system, and if they are not already in the system, we could flag them as a new contact so that you as a liaison can see who are the new contacts in my territory, the new providers that maybe we should be doing an outreach to if you don't already know that. So that's been an integration data point for some of our clients, just to keep the field aware of new referrers that they may not have found out about yet, as one possibility.
So a couple of other questions in the chat. So the question was, we can integrate new providers monthly. I think we can set our own cadence, Rocco, whatever makes sense. Is that correct?
Oh, yeah, we have one of my clients, we get data feeds once an hour.
Okay. Okay. The other question is, can we create specific targeted outreach plans with a target provider or, providers or clinics that are listed, and then planned events? And I said, yeah, I think so. That would just be a future task that would include the relevant doctors, and then you could add relevant notes, et cetera. Is that correct?
Exactly. And then, this is a CRM system, so I don't know what the world's current thinking is about emailing docs, but if you put 20 docs on an event list to let them know about an event that you're doing, the system you can make a nice looking email invitation and send an email blast to all of them. If you email out of Dynamics, it will tell you if the person opened it, if they clicked on a link, if they opened an attachment.
That's
before they
amazing.
ever reply. Now that's individual emails that you initiate from within the contact record. So if you're communicating with a doc and you email them, it does all of that. Yep.
So we could use that to manage invitations to lunch and learns, events, you name it, and then we could do boots on the ground follow-up. But how convenient to have all of that living in one place. I mean, especially with the integration with Outlook, we're not managing two different lists, and then having the metrics on did they open it or not that's terrific.
Yeah, and it's getting late in the day and my tongue got a little loose. Let me be perfectly clear. Individually sent emails from Dynamics get that tracking. Bulk send emails. I sent this invite to 20 docs. They turn that tracking off for some reason. I think it's because they sell a $10,000 marketing package and they don't want to step on it, is my personal thought.
Yeah.
Now, if you have that, either Dynamics marketing or another email marketing add-on, but I don't have any liaisons that do it because they don't do I have customers that send hundreds of thousands of emails a month. They need a sophisticated email marketing platform. I don't know that you need that. Now, if you had multiple departments in the system, that might be different. But so anyway, just full disclosure, I said it and I tried to pull it back, and you pulled it your way, and I'm pulling it back as well.
That's okay.
Individually sent emails, individually created emails get tracked. Bulk emails can be sent, but you don't get the tracking.
That's okay. I think just the ability to be able to communicate with our customers via email and have those records automatically as part of the CRM or the PRM for us is really increased functionality that we don't have today. So
Oh,
I
absolutely.
think that's a win.
And you're able to go, for instance, let's suppose we wanted all of our family med docs are going to be part of this initiative. There aren't that many, and only the ones that are A's and only the ones in the North Territory. You know, I could use filters to get the list of who I want, and then I can select them and create a marketing list with that list of people. There it is. Add to marketing list. And that would be my invitee list. So there's tools, and your account rep, let's say you had a team and they have an event coming up in June and they want to really take advantage of it. I'll just assign, that your rep from us can work with you in the planning and use that to train you on how to use those marketing features.
That's great.
Yep. That's, it's use it or lose it. If we did training in March and you didn't have an event until June, people would have forgotten. So we encourage people, hey, when the time comes, call us and we'll combine training and getting the task done at the same time.
One other question, Rocco, can you assign tasks to colleagues? So for example, if I partner with someone who is really primarily the cardiology rep, but I uncover something with my customer, can I assign that through tagging or some other mechanism to a colleague? And then if so, do we know when it's completed? And then similarly, when we create events and add colleagues, do the events appear on everybody's calendar?
I got the tasks and I didn't hear the last part of the question.
Okay, well, let me let you answer the tasks part first, and then I'll ask the calendar one.
Yes, the first answer is yes. So when I was logging my visit, and so there's a field here called owner. It defaults to whoever is creating the record. But if I change this and assign this task to John on my team, now that task is assigned to John. Now the system keeps track of different fields, so it knows who the task was created by and who the current owner is. So if I'm the kind of person that assigns tasks, I could have a view, show me all tasks created by me if they're still open. And I'll see my tasks as well as tasks I've assigned to others. And I'll see the status. If the task isn't on there, or if maybe I don't want the tasks that are open, I want all the ones created by me in the last 30 days. And I'll see whether they've been, if they're in process, if they've been completed. There is a status field here. If the status is open, if it's a task that takes a little bit of working on, the person can change the status to in process. And when it's done, they just hit the mark complete button and it changes the status to completed. So that was a long answer. The short answer would have been, can I see if I assign a task to someone, can I see if they completed it? The short answer is yes. Okay. Absolutely.
I think that's great. Okay, so Sarah, that was the first part of your question. The second part is if we create an event and add our some team members, colleagues, does that event also appear on their calendars? So I'm the creator of the event, but I'm including some of my team members in that event. Does it populate their calendar?
In the current version, it doesn't, because an event is one thing. Appointments are what live on a calendar. I
Okay.
don't see any reason why, though, if you were that we couldn't on the event form have a place where you could check a box that says generate appointments, and it will create appointment records and invite in your other team members.
Mhm.
And then they will get the appointment, which does appear on their calendar.
Great.
So I think it's not how my demo system behaves, but that would be a simple change
Okay. That's
from
awesome.
my perspective. Yeah.
Rocco,
Okay.
thanks for this. I'm smiling ear to ear for most of this. But our market in Chicago is one of the ones really interested in the functionality around like dialysis center rounding for our transplant program, or other facility rounding. And one of the problems we've run into is that oftentimes we're trying to log to a medical director who might also be associated with another practice, right? Think nephrologist who's part of a practice of nephrologists, but is also serving as medical director, and we're calling on them in the way that non practice functionality works in the system. Is that an issue, or have you guys built it to account for that?
It's not in my demo system, but we've had a lot of clients where, I mean, in my world, I work for Innovative Cloud Solutions. The company is Innovative Cloud Solutions. I'm the contact at Innovative Cloud Solutions. It doesn't make any sense to me that somebody would work for more than one company. But that's because I'm not in healthcare. In
Right.
healthcare, everything is more. So typical CRM system, we call it a parent-child relationship. The parent
Right.
is the account and the child, and it's a one-to-many relationship, meaning one account can have many contacts. But we have lots of clients where it's the absolute opposite. One contact, this doc works 3 days a week at this clinic for this employer and 2 days a week at this hospital for that employer. And so it's just the reverse, and we have that. We can more than accommodate that just fine.
Great.
It's
Thank you.
very common to my team, but it would blow most people's heads up if they.
Yes.
Yeah, great question though. Great question. Yep.
Thanks.
Yep.
Hey, anyone else have, sorry, go ahead, Jenny.
I was just going to say I have one more if I can. I think you showed this with the event coordination, Rocco, so I don't know if there's any difference, but we often are doing sort of single calls or a couple of calls with a specialist. So it might be our employed specialist going out to, some community docs. Does that, much like the event functionality, I'm assuming you've got the functionality to include or to indicate the doc that came with you, right, who participated in the round, as well
Yeah,
as log it to the practice that you're calling on?
exactly. So in this field here, I believe it is. So I can log one appointment with that I visited Bay Creek. I don't know if you can see my screen.
Yes.
And I met with these three providers. I only create one visit, but it's going to create an activity for all three of those docs. And I could have put 30 in here. The system doesn't care. So as long as the doc is a contact in our system, you can create one record. And then the only thing we need to know, because I've been told both ways. If I go to Bay Creek and with a doc and as part of an initiative, and Dr. Peterson came with me and I met with these 3 docs. Does that count as 1 visit or 3?
Well, if you had 3 individual conversations, I would say that it counts as 3.
Okay, I would too, but I've been in
It's
other
depends on,
implementations.
yeah, it
Yeah, I
depends on
know.
the
Yeah,
leader, right, and how they do
yeah,
it, but
Yeah,
yeah.
and I think maybe my question was more about the difference in the role, right? So it's 3 docs that we are calling on, right? We're promoting something to 3 docs, and then the 1 doc who is coming with us, participating in that, effort. And I saw it like that in your event log, right? Where
Yes.
who is part of the promotion, and I just didn't know on the individual calls, does it work similarly, or we're just including them as an attendee?
Yeah, great question. You guys are really paying attention. In my demo, I only showed the docs we met with, but if you wanted staff attendee or something like that, and that would link to that doc, that physician's contact record, that's it. It's just adding a field to the form if it's
yeah,
not
Jenny,
already there.
I would think we could customize that. And if we move in this direction, my vision is to create an advisory group or a group of us who are going to come together and really talk through the nuts and bolts of how we should build this to where it makes sense. That's a very common use case, what you said. Bringing a
Right,
doc might be
right.
bringing a director of surgery or an administrator. We need to be able to account for who was with us on that visit. So that's
Right.
something that would definitely be on the list for us to
Because I think
tackle.
with the advanced reporting, there'd be a lot of cool work you could do about, right, who was out to where, again, like looking at the geography that you had that specialist out to. So I'm intrigued by all of that. So thanks, Ann. That
Yeah,
sounds great.
Yeah, no, that's a great,
absolutely.
that would be, I'm gonna put that on my wish list for the demo. That's a great add-on because it's an easy thing. Now, I recognize that because somebody, I think it was Melinda maybe, said, she can write a book on horror stories from failed implementations. When somebody goes, oh yeah, we can add that, we can customize that, that usually gives people illness. In our world with this platform, when I say we can add that, it means literally nothing to me. I mean, I'm talking about minutes of time on our part to do it. And when I say that, it adds 0 to your cost. So we happen to have a very nimble, very responsive, very easy to adapt platform. And so we encourage these things. Sometimes, I say it so willy-nilly because we do this all the time. And then I have people tell me later, well, so-and-so was like, that was the last thing they wanted to hear. But it really is what we experience here.
So, Rocco, another question. We talked about providers being, wearing a lot of hats. How do you solve for a provider who maybe, and I think we talked a little bit about this, who would need to be listed with more than one account? So let's say they're the medical director at a dialysis clinic, they're a department head in nephrology, and then they also are in a XYZ practice. So can the provider be listed with more than one account?
Yes.
Okay, I thought so.
So what I showed was one account, Bay Creek, and multiple providers, right?
Hmm.
Uh, when we have the reverse, I would see a provider, and then there'll be a grid of all the accounts that provider is linked to. So it's just the reverse of that wiring.
Okay.
But that's all that it is the reverse. Now, so when I do an outreach to that doc, I'm going to count that I visited that doc. What gets goofy is, does that visit count as a visit? If he's at one place 2 days a week, another place 2 days a week, another place 2 days a week, if I visit with him on Thursday, Do I treat it as a visit to that account with that doc, or do I only care about logging I visited with that doc?
My vote would be you only care about visiting with the doctor.
Okay, then that's simple. If we had to know, because he's related, when Dr. Lieberman is only linked to Bay Creek and I visit with Dr. Lieberman, it always counts as a visit to Bay Creek. But when Dr. Lieberman is linked to 3 different accounts, I would have to log when I visit him, which account I was at when I visited him, if I needed to credit that visit to that account.
Yeah, I think it's all in the reporting, right?
Yes.
And that would be something that this advisory council that I have in
Exactly.
mind, that we would talk through that. I think everybody will have probably a little bit of a differing opinion, but we'll have to come to a consensus on that. But I would think it would be just logging the visit with the provider.
Perfect. And again, our teams have been through thousands of these use cases and scenarios, so they'll ask questions during the design discussions, which will become annoying, but they're things we didn't ask them the last time at this point, and then it became an issue, 3-6 months later, because okay, now they want it this way and we didn't build it that way.
Yeah.
So we do our best.
No, this is great. And what I'm seeing now in the chat is just an appreciation for exactly that you have worked with thousands of scenarios. So these aren't left field. These are things you've dealt with. And I think the other benefit of that is you can help us think outside the box. Maybe we haven't thought of something that some other organization has tackled and they've done a great job. We can learn from them too. So I think that your team and your expertise would be a great value add for us.
Yeah, we've done it a long time. I can't say that I like it. I mean, it seems like we never get an easy request from a hospital. And when we get an easy request, now our reaction is we don't understand it well enough yet, because if it sounds easy, we need to ask more questions because it's never easy.
That's so funny.
Yeah.
Well, team, I know we're coming up on our time. Does anyone else have additional questions for Rocco? And if not, if you've thought of something or if you think of something later, shoot it my way and I'm happy to get answers for you. I'm not seeing any activity in the chat, but if there are no other questions, we are going to send the survey out. We desperately want your feedback and appreciate your discernment of this opportunity for us to really make a meaningful change if we're going to make a change from Tracker Plus. So any other feedback, comments? Getting some thank yous from a couple of people. Thank you. Thank you. Okay. Be expecting the survey in your mailbox. It'll come from David Ryan, and he'll be sending that shortly. Rocco, thank you so much. As soon as we compile all the feedback, I'll be back in touch with you, and we'll go from there.
Great. Thank you all very much. I know how hard it is to get out of the field for a couple hours, and I appreciate your time and would love the opportunity to work with you guys. So
thanks so much. Have a great afternoon, everyone.
Bye, everybody.